We're going to take a little bit of look at stuff this time. First one there was just kind of trying to introduce you to stuff here. So what we'll do is we'll take a look at some of these different blood vessels, do some images here, and then we'll go to the slides to take a look at some of the other ones there. So arteries and arterioles versus veins and venules. Really, the biggest way to tell these apart is really to look at, like it says there, the wall to lumen ratio. Arteries and arterioles will have much more wall to a much smaller lumen. They also tend to hold their shape a little bit better, where veins, thin wall, bigger lumen, a lot of times it will flatten out a little bit more. So that's probably the best way to tell some of this apart. Again, you can kind of see it here even in the cartoons. See much larger lumen, larger externa, bigger middle layer, more circular, kind of compact wall look on the arteries. Arterioles, like it says, small lumen, generally 1 to 3 layers of smooth muscle. Tunica externa, like I said, on those is really thin. Venules, again, can have really thin walls relative to arteries or arterioles of the same size. And again, on this one, everything is thin, but the externa will still be the thickest of the bunch here. Sometimes you can see smooth muscle, but you don't see the rings of smooth muscle like you see in an artery. And I can show you this stuff in just a second here. So you can see an arteriole right here. You can see how there is some smooth muscle right here. You can see the endothelial lining, the blood vessels in the interior, where you can see the small venule up top. Maybe not the best picture of it, but we'll take a look at some more of these. Again, you can see arterioles here, more consistent circular structure on the wall. Capillary, you can see just a very small opening on that one. Again, these venules, you can see arterioles are these ones here, these venules, very thin wall, huge lumen right there. Same thing right here, thin wall, big lumen, artery, thick wall, small lumen. As we work our way up in size, you're going to see these start to even be a little bit more obvious, I think. Muscular arteries are the middle-sized ones here. Again, you can really see the smooth muscle wall on those ones. Elastic arteries, you can start seeing that elastic tissue quite a bit. Again, dealing with the changes in blood pressure due to the heart. These muscular arteries are really get their name because they are really controlling where this blood is going. You start regulating flow a lot. Like I said, there are up to 40 layers of smooth muscle in here. And again, generally as arteries get larger and larger, they tend to get more elastic tissue with the smooth muscle. The smaller they are, the more it's just muscle. So to take a look at a muscular artery picture right here, you can see very large middle layer, and you can see the endothelial layer, and then that layer, where if we start looking at it right here, you can see the similar thing right here. Tunica intima, that lining, this thick layer of the media here. And then this one has a tunica externa. This is a rather large one, so you do see the vasa vasorum on that one, the vessels for the blood vessel. This is a little bit smaller one. To me, this one sometimes you see quite a bit. When you're looking at these under the scope, a lot of times, to me, the tunica intima, because of this muscle and the elasticity, it will kind of start looking like a hair scrunchie that somebody let go of, and it kind of does that little weird pasta look to it here, where you can see this waviness to it. Elastic arteries are the biggest ones. These ones, like I said, are a lot more elastic tissue relative to the smooth muscle. Again, still a lot of smooth muscle on these ones, but in terms of if you start looking at the relative amounts, the elastic tissue on these ones starts being a little bit more prominent. And again, when the heart's contracting, these have to withstand that pressure pushing out on it when it does this. And again, on these elastic arteries, tunica intima, a little bit thicker than the muscular arteries because it has a bigger subendothelial layer, more connective tissue in it. A lot more elastic in that tunica media. Still some smooth muscle there, but more there. And then again, tunica externa is thin, decent amount of vasa vasorum in there, and you do have these elastic lamina, but you just can't see them. But the main thing in this one, we've looked at dense elastic tissue before. We looked at the aorta, and you can see all this elastic tissue in that tunica media. Lots of fibers in here. Really gives this ability to be stretched out and then come back to its normal shape. You can see a little bit thicker tunica intima, again, because of some of the connective tissue underlying that one, that subendothelial layer. Veins, on the other hand, generally all layers of the walls are going to be thinner relative to an artery. Again, tends to the veins, their thickest layer tends to be that tunica externa. Generally, 55% or more of the blood is in these veins at any one time, so they can hold up to 70% of the total blood volume at any time. And again, small medium veins, thin intima, thin media, rather thick outer layer. Again, does not have a lot of collagen fibers, does not have a lot of muscle in there. Because of this, these don't tend to stay open as well. The other thing we can see, and sometimes you can find this in these veins, sometimes not, but there is valves in there that are these one-way check valves, so kind of doing something like this, so when the blood goes up through it, it gets through and then it will seal back. This helps get the venous return going back to the heart, so the blood doesn't pool in your legs, for example, if you're standing up. And again, it's the skeletal muscle contraction, your breathing, that helps move this blood back to the heart. And you can see with the arrow right there, an image of that one-way valve going through this one as an example. But again, you see a small muscular artery, a small vein. Notice on the muscular artery, much thicker wall. You can see the smooth muscle layer. You can see overall it holds its shape pretty well. A vein of a similar size, much thinner wall, much larger lumen relative to it. And to me, this is stuff I would expect you to be able to do. If I showed you similar artery and veins of similar size, I'd expect you to be able to tell them apart and know which one is which. And then also being able to tell apart the different layers of those blood vessels. So again, you can see a muscular artery versus a medium vein. Again, you see that squiggly line here due to the elasticity of that holds its shape, where you can see the vein of a similar size, medium-sized vein, it's collapsed down. You can see that externa. You don't see a lot of smooth muscle, but you can see a lot of the externa. And larger veins, again, thin layers of the smooth muscle, lots of connective tissue. Tunica adventitia or externa relatively thick. We'll have those vasa vasorum in there. Sometimes we'll have a longitudinal layer of muscle on this as well. And again, you can see it right here. You can see a valve in this one. That tunica adventitia, the tunica media, you can see is quite thin. Lymphatic capillaries are another one here. These unidirectional flow, the smaller ones are like capillaries, leaky capillaries. As you get these capillaries getting these lymphatic vessels, they tend to look like medium-sized veins in reality. And you can see some here. It's not something I'm going to have you trying to identify on here at all, though we're not going to do lymphatic vessels. So next time we'll take a look at kind of the heart wall and a few blood vessels here. This would probably be a muscular artery and a medium-sized vein next to one another. You can see left side of the field of view would be the vein. You can see how it's kind of collapsed. Right side is the muscular artery. We'll zoom in just a little bit here. Oh, a little too much here. So if we look at the muscular artery real quick, you can see, all right, here is that tunica intima. You can then see all the smooth muscle in that tunica media. This would be the tunica externa. If you look and zoom in on it just a little bit, that is actually a vasa vasorum right there. So there's a blood vessel that's in that wall. So you can see it right there. You can see on the artery, on the vein over here, much thinner layer of each of these, and the tunica externa is probably from here out, so much more of it there. If we look at some of the other examples here, so this is showing you some smaller arteries and veins. And if you're looking at these structures right here, you can see on this one, this would be an artery down the bottom here. Again, you can see the tunica media is the bigger layer here, where this would be a vein of a similar size right here. You can see much larger lumen relative to the wall size. Again, kind of collapsed because it doesn't have that structure necessary to stay open. And again, you don't see a lot of that smooth muscle in the walls. And again, you can see another artery right down here. This is looking at more of an elastic artery. Again, the main thing you notice on this one, here's that inner lining. All this would be the tunica media right through here. Then that tunica externa. Again, you can see a lot of the elastic fibers in that middle layer, and that's how you would kind of differentiate that one.